What is the link between concussion and chronic fatigue? So many of the patients I see who come in 3 years, 5 years, even 10 years down the road come in for chronic fatigue. And they come in and say, Dr. Zimmerman, it's got to be my thyroid. My thyroid has to be off, or it's got to be my hormones. The thing is, they've had their thyroid checked 10 times. Every time it comes back, it is completely normal. And this is very frustrating for them. As we're digging through their history, there was a whiplash injury in which they received chiropractic care or physical therapy care. And they still have lingering issues with neck pain, fatigue, sleep, word finding, all of these which are really suggestive that a concussion had occurred but was not properly treated. So why does a concussion cause chronic fatigue? One of the many things that happens when a concussion is sustained is the brain is no longer able to produce and use energy the same way. Imagine trying to drive somewhere using a tractor versus a car. It's going to take you a lot longer. It takes more time to be able to do it. So because it's inefficient, it uses more. So now these tasks that should be very simple, such as reading, emails, text, watching TV, trying to multitask a little bit, it zaps you of your energy. Even though before the concussion occurred, it really didn't have a meaningful impact on you. And so it starts draining you. So instead of having this full tank of gas, you're down to a quarter, you may have half, depending on where you're at in your recovery and where your brain health is. The good thing is, as we identify the cause of your chronic fatigue, and if it is a concussion or other brain-based issues, as that gets treated, as we reconnect the brain appropriately, now the brain starts using energy more appropriately, and you're able to build up that tank and no longer live at half a tank, quarter of a tank, but you start inching your way up. The next thing you know, instead of feeling tired all day, every day, now all of a sudden noon is when you get tired, and then 2, and then 4, and then 6. And this is the trend we see with a typical concussion recovery. Every day doesn't start out as a great day or finish as a great day, but as you go through the proper steps, the time you feel good starts lengthening, which is a fantastic sign because it means you are well on your way to recovery.